Okay, if we're going to recreate this old pic of us that Mom posted, we've got to get the outfits right.
Well, for some reason, I can't find gauchos with a matching shrug anywhere.
Let me try on my Samsung Galaxy S24 Ultra. I just use the S Pen to circle the outfit in the post, and bam, 5 sites to buy it from right here.
Shut up! How did you...
You shut it. Mom's coming.
Cute outfit. Get me one.
Circle it, find it with the new Galaxy S24 Ultra and circle the search with Google. Upgrade now at Samsung.com. Internet connection required. Results may vary based on visuals.
Today on CityCast Philly, here in the city, 1 in 5 Philadelphians don't have a primary care physician. That's the doctor you go to for your annual checkup, flu shot, or even to get a referral for a specialist. But it can also take months just to make an appointment with one. So why are there barriers to establishing healthcare in Philly? I'm talking with a local medical student who wants to tackle this problem. It's Wednesday, February 21st. I'm Trenae Nuri, and here's what Philly's talking about. Kelly McGuigan, you're a medical student at Sidney Kimmel Medical College at Thomas Jefferson University, and you wrote an op-ed about how hard it is for Philadelphians to find and establish primary care. Thanks for being on the show.
Thank you for having me. I'm happy to be here and talk about this topic today.
So, Kelly, let's start with the basics. What exactly is the role of a primary care physician, and why do we need one?
Yeah, so a primary care physician, also known as a PCP or a primary doc or your primary care, can be a doctor, an NP, a PA, a medical professional that kind of takes care of your overall or general medical health. Someone you can talk to about preventive care, vaccines, screenings for cancers and other things. For me, this means someone you see at least annually. They talk about your health, talk about mental health too, which I think is really important right now, make recommendations, set you up with a specialist if you need, and also can be someone you go to if you're sick or you have a medical question or concern. So someone that you see and have an established relationship with and can provide a lot of different things for you.
Thanks for breaking that down. Kelly, you also wrote how challenging it was for you to find a primary care physician in Philly. I mean, you're a medical student and someone who works in the industry, and it was difficult for you. Why is that?
As a medical student, we just try to find things to do that are helpful for our team and for patients. And one of them is getting them scheduled for follow-up appointments so that they can see these doctors they need to. I saw this a lot. I saw this every day when we tried to make appointments for patients that were leaving the hospital or needed a follow-up. And then it kind of happened for me when I was kicked off my parents' healthcare. So at the age of 26, you can't be on your parents' healthcare. Mm-hmm. And this happened when I was in medical school. So I got on our school's insurance, was looking for a new doctor that's close to me, someone I could establish care with, and that was in network, so it would be cost effective for me. And it took me months to get an appointment. And then the physician or NP just happened to get sick, I think the day before, which happens, but that made another few months until I could get in to see her and have my appointment. And I was sitting in the office, and it happened to be a day before a test I had when normally I'd be studying. And I'm sitting in the office waiting for an appointment thinking, why does it take so long? Why is it so difficult? And if I can get frustrated doing this and I know how to do it and how to work the system in theory, what's everyone else going through?
For sure. Kelly, how many primary care physicians are working in Philly?
Yeah, so technically we have a lot. And I got a lot of feedback from my article that these numbers looked pretty good for Philly, that we have one primary care doc for every 1,243 residents in Philly. Sounds pretty good. It's around the average for a city, around the national average. Yet, why is it so hard to get a doc? And as we talked about, 1 in 5 people don't have a primary care physician in the city. There's a lot of different factors, I think, that contribute to this. If you look at the bigger picture, maybe we have enough doctors in Philly. We have a lot of great medical centers, medical education centers, but a lot of these doctors are in training. So is that contributing to this number? A lot of these doctors are teachers. They don't work full time seeing patients. And if you looked at the number of doctors by neighborhood, there's a big disparity. So maybe in Center City, we have enough doctors, but in the Northeast and the Southwest, we don't have enough primary care physicians. We don't have enough doctors that accept Medicaid, and there are longer wait times for Medicaid. And these lower number of PCPs are specifically seen in neighborhoods that are lower income or in higher proportions of minority residents. So this affects, the health of our whole city, how crowded our emergency departments are. So I think looking at that bigger picture kind of shows maybe we have enough doctors by number, but then why is it so hard to get an appointment and see one?
Right. So you just mentioned some of those barriers, and that data that you're referencing is from 2018. So we reached out to the Philadelphia Department of Public Health to see if they would come on the show or share more updated data on this topic. Former Health Commissioner Dr. Cheryl Bedegal said the department is updating their numbers, and here's a statement. We are working on improving access to primary care through our work to build 2 new city health centers where the need is greatest.
I think it's positive that they're recognizing that there is a problem and working to make change. We do have a lot of health centers in Philadelphia. I think they are very useful and helpful for people that are underinsured or uninsured. And I think that's one solution. I think we need more solutions that are creating more primary care doctors. From the position I'm in medical school, we need more people going into primary care. And we need to make healthcare more accessible through cost and insurance so you can see other doctors. So I think it's great. We're working on it. I'd like to see some updated numbers. And I'd like people to believe that even though maybe the numbers look okay, we need to look at some of this other data, like how long the wait times are to get an appointment, to kind of really tell what the access to healthcare is.
More on finding a primary care provider in Philly after the break. This is CityCast Philly.
This episode is brought to you by State Farm. You might say all kinds of stuff when things go wrong, but these are the words you really need to remember. Like a good neighbor, State Farm is there. They've got options to fit your unique insurance needs, meaning you can talk to your agent to choose the coverage you need, have coverage options to protect the things you value most, file a claim right on the State Farm mobile app, and even reach a real person when you need to talk to someone. Like a good neighbor, State Farm is there.
This episode is brought to you by Etsy. So you need to get an amazing gift. Wait, no, the perfect gift. And it needs to say, I'm a thoughtful person, and I appreciate you, and I know exactly what you like, all at the same time. Well, Gift Mode on Etsy is here to take the stress out of gifting, so you can find the perfect item for anyone and any occasion. It's easy to find gifts made by independent sellers for all the people in your life, like the pickleballer, the jazz fan, or the pasta lover. From 90s nostalgia and mixology to reality TV and gaming, there's something for everyone on Etsy. Whether it's a birthday, an anniversary, a holiday, or even just a day to say thank you, Gift Mode on Etsy has you covered. Need to find the perfect gift? Don't panic. Try Gift Mode on Etsy now.
All right, Kelly, let's start with some tips to finding primary care. If I have health insurance and I'm looking for primary care, where should I start?
I think if you have health insurance, that's great. You have a little more advantage than maybe a lot of other people don't have in the city. So what I would start with, there should be a phone number on the back of your health insurance card, and you can call and you should be able to tell them your zip code. I need this type of doctor. I need a primary care specialist, who's nearby and in network. This is going to help you get the best cost per doctor. You can also go on their websites. Some of their websites, I don't know why, but are kind of outdated, like the one for my insurance is, but they have a similar tool where you should be able to search by zip code and find the type of doctors you're looking for. So I think that's a great step for smaller practices. You can call up the office and ask them, do you take my insurance? Will I have a copay, which is an amount of money you might have to pay at the visit, and see if they can set you up. Like Jefferson, I'm at, we have a website and a hotline, 1-800-JEFF-NOW, which I think like Penn, Temple, and some of the other big places would have too. And you can go on and schedule them. This is how I help patients. So that's what I would start with if I have insurance.
What if I don't have health insurance? What are the first steps for me?
If you don't have health insurance or maybe underinsured and some of these places don't take the type of insurance you have, like we talked about, Philadelphia has multiple health centers, and they launched this website finder, and it's phila.gov/primary-care. And it's a search tool that you can search by language. You can search by the type of care you need, like maybe blood work or testing. And it should give you information for all of the health centers. And it sounds like maybe more coming up in the city. And I don't know how long the wait times are, but I think that would be a good place to definitely get the care you need, to get maybe established with someone that can help you out. I think they also might have social workers and other people there that can help you with the costs of care, with help you finding some insurance if you're interested in that. And I do believe they work on like a sliding scale. So you should have to pay like a minimal amount of money, or it's like based on your income or how much money you make.
Now, as you mentioned, you help people schedule medical appointments at Jefferson. Do you have any tips or best practices for what we do when we actually get our time slot?
Yeah, so I think it's just great overall. If you got an appointment and you're going to see the doctor or the provider, it's good to have your information that you want to talk about. So if you have questions, kind of like those list of questions you want to talk about, knowing a little bit of your family's health history and your health history, if you had any recent blood work or testing. And I think it is good to do this at a time where maybe you are feeling healthier or have the time and mental space to talk to this doctor. Don't wait until you're sick and you need someone and now you got to try to get in with someone to see a doctor. So getting this established appointment, talking to them, you'll be more connected. It'll be easier to get in. Something I always think about too, once you go to the appointment the first time, you know where it is, you know where to go, you know how long it takes you to get there.
You know where to park.
That is my biggest concern in the city. Yep. So give yourself that time to get there, because some are really finicky if you're 10 minutes late or whatever it might be. And then I think once you are in, just making sure you're open and talking about things you want to talk about. Mental health is something you can definitely talk about with your primary care. And, so make sure you bring it up if you have a concern.
We've been talking about in-person care. What about telehealth?
Yeah, telehealth, I think, is still pretty big post-COVID, post-pandemic. There were some restrictions now of practicing out of state. So technically, if you see a provider in Pennsylvania, you have to be in Pennsylvania. I think telehealth can be really accessible for some people. Not everyone has access to internet, computers, and iPhones to do it. I think maybe for some younger people that work from home, that can access this Zoom platform very easily, it can be very helpful to do follow-up appointments. We see a lot of therapy and mental health care being provided on telehealth, which I think is really great. So they can make more expanded access to that. We need insurance to cover telehealth, so providers will do it. And we need providers to continue to use that telehealth technology and provide it to patients.
Thanks so much for these tips, Kelly. You're set to graduate medical school in May with hopes to stay in the city to do a family medicine residency. And later, you want to have your own primary care practice. What do you think could help make primary care more accessible in Philly?
I think we need more affordable healthcare options, statewide or citywide. If we can get some more affordable healthcare options, we get more providers that can accept this insurance and provide this type of care. And I think kind of overall, starting at the beginning of like medical school, PA school, like NPs, we need to have more of an emphasis and positive reaction to primary care. We want people to go into it. We want young people to value it and see the value of going to the doctor every year, getting those prevention screenings. So I hope these things get better in Philly. I've lived in Philly a long time, and I love to see people getting the care they need and the overall health of our city getting better.
All right. That's Kelly McGuigan, student at the Sidney Kimmel Medical College at Thomas Jefferson University. And you wrote an op-ed that published in Billy Penn about how hard it is for Philadelphians to find and establish primary care. Thanks for being on CityCast Philly.
Thank you for having me.
For the resources we mentioned on finding primary care in Philly, check out the links in our show notes. That's all for today here on CityCast Philly. If you enjoyed this episode about finding healthcare in the city, tell a friend, rate the show, leave us a review, and hit that subscribe button. Be sure to sign up for our morning newsletter, Hey Philly, to learn more about what else Philly's talking about. We'll be back tomorrow morning with more news from around the city. Bye.